All right, Laura, go ahead. Hit me with question number 3.
Okay, I'm getting my eyelids done. Am I going to be able to see? Am I going to be blind for the first 24 hours?
It's a great question. So I find that eyelid surgery is typically it's a pretty quick outpatient procedure with minimal downtime. Sometimes I'll actually just do it in the office, especially for upper lids. If someone just has a little bit of excess skin to trim on the upper lids, we can do it under local anesthesia. If you need a little laughing gas, we can provide that too. It's pretty much a local anesthesia procedure in the office for the most part, unless I need to do something very complex. For lower lids, I tend to do that in the OR, just to help make sure to protect the cornea much better, and I do get more involved with what I do with the fat. So anyway, regarding being able to see afterwards, yeah, you're gonna have some swelling around the lids. I find that patients have a little goop inside their eye because I'll put the goop inside their eye to protect the cornea, make sure that it doesn't dry out. If under anesthesia procedure. You can have some irritation, but for the most part, I mean, yeah, you'll be able to see right away. Aside from the goop, we wash that out and you give you some artificial tears. So for the first couple, really 2 weeks, I have people using artificial tears to help lubricate their eyes, to help keep everything nice and moist, and help get rid of any kind of junk from the eyes. But actually, the recovery is quite easy. With the lower lids, same thing. I find recovery pretty easy. Where I find patients tend to bruise more so is actually when I do the fat grafting. And I often do fat grafting around the infraorbital rim, this area here. So if you ever see those people who have, like I got a little something going on here, a little tear trough action, or flattening of the mid-face, or they have kind of like this really elongated eyelid, I find that putting fat in this area is really icing on the cake. It gives you a really beautiful, turns like a great result to like an amazing result, putting the fat there. But it does cause more bruising because it's a blunt procedure. I make 2 tiny little poke holes, one here typically, depending on where I'm putting the fat. And through those tiny little poke holes, I introduce a cannula that I used to go into different planes throughout the soft tissue close to the bone to fill up this area. The beautiful thing about fat is that that's really with you for the rest of your life. Now, yeah, I mean, some of it's going to go away, and we do everything we can to try and get the best fat cells. We harvest the fat cells from where you don't want it. So typically I take it from usually the belly or the thighs, and we spin that down in a centrifuge and then take the best cells from that and put them back into your face. So that's a scoop of that, but anything that survives there is really there and will grow with you the rest of your life. You will continue to age, of course. That we can't stop yet. When we develop the magic pill for that, you guys will be the first to know. I'll probably have retired by then.